Let's talk about the most common problem of this era, that is infertility. Now, what exactly is infertility? Infertility is unable to conceive, or we can say unable to have pregnancy even after 1 year of unprotected intercourse. 60 to 80% couples in the world are infertile, from which 23 to 25% couples are from India. We can divide infertility into two types, primary and secondary. Primary infertility is the one who doesn't have any child, and secondary infertility is previously having a child and now unable to conceive.
Going to study causes of infertility in female. First, pathological causes: defective ovulation, defective implantation, and defective transportation. Second, unhealthy habits. These are environmental effects, toxic effects, unhealthy diet, lack of exercise, obesity. Medical conditions, they are lupus, mumps, diabetes, mellitus, amenorrhea, cystic fibrosis.
Necessary investigations for infertility. Investigations gives proper direction for treatment. So for prior treatment, couple should get done all the necessary investigations. So for males, it is semen analysis and blood investigations. In men is examined for sperm count, sperm motility and pus cells. If pus cells are detected, then semen culture is done. For giving semen sample, there should be 2 to 5 days of abstinence. This was all about semen. Now for blood. For sexually transmitted diseases, HIV, VDRL and HbSCG tests should be get done. This was all about male investigations. Now for female. First organ is ovary. For ovary, AMH, that is anti-Mullerian test is done. It means how much eggs are left in the ovaries, that is ovarian reservoir. Then second organ is fallopian tube. For fallopian tube, hysterosalpingiography is done. It is nothing but X-ray with the help of dye. Then hysterolaparoscopy and sonosalpingiography is done. After that, uterus. For detecting any abnormality of uterus, ultrasonography is done. It will give any idea of fibroid and polyps. Then hormonal level test, FSH, LH, estradiol. These are done at the second to fifth day of menstrual cycle.
Let's look out for diet and routine. You should wake up early in the morning at 5:30 to 6 a.m. Have a brisk walk of around 1 hour. After walking, at 7 and 7:30 a.m., you should have a glass of milk with 2 tablespoons of Shatavari Kalpa and 2 tablespoons of Pal Group. In the breakfast at 8 to 8:30 a.m., you can have pohe, upit, sushila, shira, kheer made with ample amount of gruth. At afternoon, before your meal, you should have 2 tablespoons of gruth with warm water. In lunch, you can have pulses, rice, specifically moong dal with gruth, vegetables such as shepu, padwal, dudhi bhopala, chutney made of javas, karada and shengdana. You should avoid spicy, oily food products made of maida, bakery products, junk food, and you should also avoid sleeping at afternoon. In evening around 4 p.m. you should have seasonal fruit juices or simply the fruits. You can have tender coconut water, buttermilk or decoction made of coriander or cumin. At night you can have the same meal. Before going to a bed, you should have a glass of milk with 2 tablespoons of Shatavari Kalpa, 2 tablespoons of gruth. Weekly, you should have a dosa or a gutti made of udit dal. You should take a daily sound sleep of 7 to 8 hours. The diet and routine dictated above may vary from patient to patient, and specifically you should consult your doctor.
Let's talk about basic line of treatment of infertility and its basic formulations. Male and female both are integral part for reproduction, hence the line of treatment should be equally followed for both. Basic treatment is based on Agni, Bala, Kala, Dosha, etc. factors mentioned in Ayurveda. Firstly, Deepan and Pachan is done with the help of medications. Then Snehapan means intake of medicated Ghrita. followed by Yoga Basti, that is alternate Anuvasana and Niruha. And then lastly Uttar Basti is done, which is special treatment for infertility. Now we will talk about some formulations which are used in infertility. That is Shatavari Gruta, Falagruta, Shatavari Kalpa, Vanari Kalpa, Vanari Gutika, and some Rasakalpas are there, Chandra Prabhavati, Siddhamakaldhvaj. Basic information about infertility, it may change from patient to patient. So for good results, consult gynecologist in Ayurveda Rugnalaya, Sterling Multi Speciality Hospital, Nigdi, Streeroga Department, OPD number 119.